Hello everyone. I think that is my cue to start. The lovely Emma from Leukaemia Care. We all met in the room to the side, virtually of course, just before we started, and she was like, "Right, when I take the slide screen down, that's your cue." So I hope people are there and listening. I can see my fellow panelists, so that's a positive start. Hello to everybody coming in. Welcome. I wish I could give everybody a cuddle, #IRL, but not quite yet, one day. So welcome to the collaborative event with the Eve Appeal, Bloody Good Period and Leukaemia Care. Tonight we're going to talk to you all about what happens when vaginal bleeding isn't just a period, because it's actually a sign of 3 of the 5 gynecological cancers, which I'll talk more about later, as I'm the Eve Appeal representative and co-host. So, you know, I wear many hats, but it's, you know, it's a cross I try and bear. And also a sign of leukemia, which I have been in the gynae health sphere for about 5 years now, and only after Emma, who I'll introduce in a minute, I'll drag her on, only after she contacted us about this potential event did I have any clue that abnormal vaginal bleeding was also a sign of leukemia. I was like, why is this woman from this charity emailing me? Go away, this is a vagina space, no thank you, what's that got to do with you? Little did I know, and after a bit of planning, here we are. So I'm Karen, I'm from the Eve Appeal. I'll be sort of steering the ship, but everybody is so wonderful that hopefully I won't have too much to do, although I do like the attention, so I'll find a happy medium. So I'm just going to, before we get stuck into the panel, introduce Emma. Emma Hyde-Nero, who is the fundraising officer. No, you're not. Campaigns officer. I don't care what your job title is. I just see a beautiful woman. The campaigns officer from Leukaemia Care. So Emma, take yourself off mute.
Hello.
You're not fundraising. She's probably like, I don't know how to ask for money.
I'm not good with numbers, so
no,
that would not suit me. Thank you so much, Karen. That was a beautiful introduction, and I'm worried that I'm going to giggle now. But
that's fine, because we are talking about heavy subjects and heavy bleeding, but it doesn't mean that the chat has to be heavy.
Wow, Karen really does have a way with words. Just going to put that out there. The slogans that she's come up with, amazing. Anyway, thank you, Karen. So thank you everyone for joining us tonight. So Leukaemia Care, Bloody Good Period and the Eve Appeal are proud to present When It's Not Just the Bloody Period, Abnormal Bleeding and Cancer. So what's this webinar about and why are we hosting it? So as you might know, September marks both Blood Cancer Awareness Month and also Gynaecological Cancer Awareness Month. For leukemia and gynecological cancers, there are symptoms that are specific to individuals who menstruate. For example, in some cases, symptoms can include heavier than usual menstrual flow, uncharacteristic bleeds midway through a menstrual cycle, and spotting after the menopause. Despite this, there's a real lack of knowledge surrounding the relationship between the menstrual cycle and cancer. Important presenting symptoms are being left out of the narrative. And women, this is through some of my research, prioritise uterine and vaginal health lower than most other health issues and ignore significant changes. So we really want to try and change this. We would like to use this webinar to encourage conversations about menstruation and equip individuals who menstruate to recognise changes and when they should see a GP. In the words of the Eve Appeal, we want every individual to know they're normal and to get abnormal bleeding checked. We have a panel of amazing individuals here to talk to you and answer any questions you might have. I'll hand you back over to the incredible Karen for this evening, who will take it from here and introduce you to our panelists. Thank you, everyone. Over to
Bless her, she's been so nervous for weeks. Emma, I don't care, we're all very open here. I'd say you're nervous, but you smashed it. You're so good at this sort of thing. Like, have faith, you nailed it. Do more.
Thanks, Karen. You're honestly going to be my life coach from now on.
That's actually quite a lucrative career stream. So in all seriousness, we'll see how this goes, and let's see. I'll do a little survey to you afterwards. How do you feel on a scale of 1 to 10 that I made you feel after the event? So we're going to hear from 3 wonderful people, then me, so 4 wonderful people, and then open it up to questions. If you've got questions whilst myself and the other panelists are talking, you can put them in the chat box, and then Emma will put them in a document that I've got access to that I'll go to at the end of all of us speaking. So yeah, there will be time for questions at the end. If you think of anything, just write it down so you don't forget. So this section should last until about 8 o'clock, maybe a little bit sooner if we talk very quickly. And also, I know that Bake Off starts at 8 o'clock, okay? So if I see the numbers dropping at 8 o'clock, just before we start the Q&A, I'll know exactly what happens. It's because you want to see the soggy bottoms, okay? And I would say cancer is more important than cake. So please have Bake Off on the TV by all means, right? But also still tune in and have some questions answered. But also, I'm not judging. You can just live your life however you want. So our first panelist is a wonderful person called Terry Harris, and her job title is Menstrual, Sexual and Reproductive Health Manager, so very greedy, from the brilliant Bloody Good Period charity that I have an extra special soft spot for, because one of my very best friends in the whole world is the CEO. She's called Gabby and she's gorgeous. She's not here though, so we'll have to stick with Terry. Yeah, so Terry's going to talk to us about menstrual health and the taboo and stigma surrounding that. Yeah, I'm just going to have a bit of a chat. So, hi, Terry, come in.
Hi, everyone. Karen, you made me laugh so much. I'm worried I'm going to like snort on camera now.
Well, this is a very serious conversation, Terry, so I suggest you pull yourself together.
Thank you. And thanks for the introduction. Yeah, so I have a very long job title, but I basically lead the kind of education program at Bloody Good Period. So for those of you who don't know us and what we do, we fight for menstrual equity and the rights of all of those who bleed. So what that means is it kind of works in 2 ways. We deliver period products to those who are less likely to access them, and also deliver education sessions, which I do, with medical professionals to refugees and asylum seekers across England. So we're really excited to be here today. I've seen the damage, and we see the damage that period stigma and taboo does through our work, through our campaigns, through our education sessions, and also through the lives of the people that we work with as well. So we think this is a really important session. I'm glad that you're all here. So in my role at Bloody Good Period, as I said, I deliver out education sessions. So we work with refugees and asylum seekers. Because of the current hostile environment in which refugees and asylum seekers live in the UK, they are less likely to access NHS services, and that's because there's often a lack of distrust there, but also there's a lot of language and cultural barriers that are overlooked. So in my role, I'm kind of bringing menstrual, sexual and reproductive health to those communities with gynecologists and other medical professionals to try and increase that access. And it's very wonderful.
And Terry, do you like, so obviously you were saying about there's different barriers with the different groups that you work with, and like that might be language or culture or whatever. If we're thinking about kind of say somebody that you're working with from their background and culture, there's a lot of kind of stigma, and I use the phrase stigma and shame so often, but that is kind of what it is. How, like, compared to, for example, me who grew up in England with a family that, you know, is very open talking about that, how does kind of having shame and stigma around these topics, how does that kind of impact on how someone might sort of learn, or their knowledge about menstrual health, reproductive health, etc.?
Yeah, I think it's a really good question. I think that shame and stigma is such a universal problem that even so when I was a sex educator with young people, I would often go to schools and there would be very well educated teachers who had no idea how to label the anatomy of the vulva. So I really think it's like a universal wide-reaching problem, but often the people that we work with have very different barriers. So as I said, like language, but also not understanding how to access those services. I think in terms of shame and stigma, though, it's so long lasting. as we were talking about earlier, even not being able to say the word vagina because it's so shameful is creates so many barriers, especially when you're going to the doctor about a vaginal or uterine problem. If you can't describe what is happening to you by using kind of not even medical terms, just anatomical terms, that makes it really difficult for a doctor to diagnose you or provide you with any support. And then I also think that kind of the shame and stigma presents a lot of barriers to screening. So a lot of the people that we work with don't want to access cervical screening because they're worried about something being inserted into their vagina, the shame that that might cause afterwards, and just not having a lot of knowledge around it. So I really think that, yeah, it goes much deeper than just kind of superficial jokes about being on your period. I think it can actually really impact your health. And the last thing I'll say on that is that often, because there's such a shame and stigma, we're not taught about these things at school, and it's a universal problem again. And that means that we don't know the basic symptoms and signs of really important things. So today, when we're talking about leukemia, one of the symptoms is heavy bleeding, but a lot of people who menstruate won't know to track and look at the changes of their menstrual bleeding. They might just think, oh, that was really awful, this month was really heavy, but actually it could be a sign of something more serious, and we're just not taught to talk about that or track it.
In your role at BGP, and I can say BGP because I'm like really casual and in with them all, we're all friends.
You are.
I know you're obviously not doing one of your sessions now, it's kind of not like bring your Karen to work day, but how, like, just because I'm fascinated by it, how do you even begin when kind of meeting a new group and having the first session with them? How do you even begin to kind of, I guess what I'm really asking is to kind of like let them know that having a vagina is okay and all of the stuff that comes along with it, you know, like having female genitals and having a vagina that bleeds is half of the world's problem. But yeah, kind of how do you even start letting them know that literally how they were born and what their body does is not something to be ashamed of?
Yeah, I think it's like so important. So we always start by creating a safe space, and I start always by making sure that everybody's comfortable with what we're going to talk about, and we kind of make a group agreement. And then after that, I will just constantly say the word vagina, vulva, and uterus to try and break down that like language barrier of shame. But I think what's really interesting is a lot of the people we work with now have children, and when we have one of these sessions and we talk about, you know, the different kinds of menstrual products that are on option are available, a lot of the people we work with will say have reflected on that shame and stigma and how it stopped them from having kind of healthy periods. So maybe they were too embarrassed to ask their parents for period products, and they don't want their children to go through that now. So I think almost once we've had a session, people have come halfway in overcoming that shame and stigma because they've got something personal going on at home. But I also think we have an amazing set of medical volunteers who are just the kind of coolest and calmest people, and are just incredible at saying things in a way that breaks that shame and stigma as well. So we never talk about kind of we talk about your normal, but we never say whether things are like abnormal or not. Just we don't want to create a barrier again, so we talk about knowing your normal and what that means for your body. And yeah, I think it's just about kind of having long-term relationships with those people and having continual sessions in a safe space.
And do you think, so you said that when you do the sessions, you've got like a medical professional with you. Do you think, I can imagine some people, regardless of where they've come from, their background or whatever, it's a universal thing, that are just scared or worried about going to the doctor for whatever reason, for fear of being judged, for fear of finding out something's wrong. Sometimes it's easier to ignore something, whatever the reason is. Do you kind of see it firsthand where you're there with a doctor, and because it's outside of an examination room, you can kind of see perhaps like fears or worries slightly subside, but because they get a chance to talk to a medical professional without having to get undressed and have an examination that might be scary, for example.
Definitely. I think that group setting is really, really helpful. So we always have a questions section at the end where people can ask anything they want, and the doctor will never give specific advice, but kind of general. And I do think once one person says an experience or asks, oh, I've got this bit of a weird thing, what do you think I should do? Then it starts to kind of break down that shame and stigma, and more people are willing to discuss. But I think there are a lot of barriers to going to the doctors and talking about it. There's a long history of people who menstruate like not being listened to or not feeling like they've been listened to when speaking to medical professionals. And I think that because the majority of people we work with are people of colour, they're more likely to experience that too. So we know from recent surveys that people of colour feel that they are less likely to be listened to. They feel that their conditions in terms of like pain and things aren't being listened to. And if you add into that mix that the people that we work with often have language barriers, they often can't relate or use the materials and resources available to them, they're much more likely to fall through the net and have bad experiences with medical professionals. So I think that's why what we're doing is so important, because it allows people to have that trust. And so they have a doctor, they meet them where they don't have to get undressed, they don't have this 5-minute brief quick conversation that all feels quite scary and intimidating. It's just quite a nice space where we all are friends and have a cup of tea and talk about vaginas, and I think that really helps kind of build that trust and build that want to go and see medical professionals in the future.
You, in that answer just then, you mentioned like how like throughout time, I mean we hear it now even though we shouldn't these days, but women and people who menstruate are statistically like less listened to, and it takes longer for you know, somebody you know, having an abnormal bleed or something, it will typically take them longer to get diagnosed with something that's wrong than if you know, a cis man walks in and says I've got a problem with my penis, that sort of thing. Although I love people with penises, I love you all, but you know, it's a fact that like I would be less listened to in a doctor's room than the man sat next to me. But can you talk a little bit more about that in terms of like the gender gap in medicine and research and kind of
Definitely.
the sort of disparity there, if that's okay, because I really want to hear more about that.
This is something I'm really passionate about. So
you go for it, babe. I'll shut up for once. And you just go for it. Go on.
If you haven't already, I'd really highly recommend reading Invisible Women, which talks about the gender gap, and there's a specific chapter on female health. But yeah, it's really crazy. There's just been such a lack of data and research into women and people who menstruate health in science and in medicine, which just means that there's just a lot of things that are unknown. So for instance, there's a lot of talk now about how people are saying that the COVID vaccine has had an effect on their menstrual bleed, but nobody kind of knows the reasons why or why that's happened. And I think the fact that like that wasn't thought about in terms of study or research says a lot. So I think generally we know that yeah, medicine is often not researched on female body and how the cycle, a menstrual cycle, affects that, because there's a belief that kind of hormones will change the efficacy of different medicines and things, and we just know that there's not a lot of research and data. I think what's interesting at the moment now is like female health technologies like Clue, like period tracking apps, are really changing that, because they're collecting a lot. Is
that world? I said I wouldn't interrupt, but is that called femtech? Or have I made that up? Oh my god, I knew something. Yeah. Because I'm now in my 30s. I often feel like not very down with the kids in terms of like modern stuff. But yes, okay, femtech, carry on.
Femtech, yeah, is collecting a lot of the data that hasn't been done before. And I want to give a big shout out to Dr. Sally King, who runs Menstrual Matters, because what they're doing is really, really important. And Sally talks a lot about how often menstrual cycles can have effects on different conditions in the body, like epilepsy and asthma, and they're just not spoken about. So I think often when we think about abnormal bleeding or weird things happening to our menstrual cycle, we don't always want to go to the doctor, because we almost think, well, like, we haven't been thought of for the whole of history. Why would it change now? I think that can be really difficult for some people.
And it's difficult, isn't it? I think even if it's kind of our job to do this sort of things, it's difficult sometimes to think of, sort of, for example, a vaginal bleed. It's sometimes difficult to think of our body as a whole body sometimes, and like the impact that one thing can have on the other, rather than I have a headache and it is just my head that's hurting. It has got nothing to do with the fact that I'm due on my period, or like, oh, my boobs are swollen because I've put on weight. Yeah, but actually they also swell when your hormones fluctuate. It's very difficult sometimes to think of everything connected, isn't it, rather than I go and see that person for that problem and that person for that problem.
Yeah, and I think that's because we've never been taught that. So I think we've never been taught that there's so many hormones and changes that happen throughout your menstrual cycle, and everything from your skin to your hair can change texture because of where you are in your menstrual cycle. So I think importantly what we do at BGP is try and teach the menstrual cycle almost as a vital sign, that you can understand a lot more about your body through your menstrual cycle than you think. And so tracking is really important, knowing what's normal to you, so how long your cycle is, how heavy your bleed is, what your vulva looks like, what your breasts look like and how they feel. They're all really, really important things to know and track, so that you have an understanding of your body as a whole, and also can advocate at the doctor. So I think often why we feel not listened to at the doctors is because we haven't gone to the doctor with the right information. So you say, oh, my period's a bit weird, but you haven't said why it's weird, or how it's changed, and how heavy your flow and things like that are. So I think being able to have the resources and knowledge of how to advocate properly at the doctor is really, really important, especially for the people we work with, so they have really easy and accessible ways to talk to their doctor about what's going on.
Of course. And just not that I don't adore you, but it's not just the me and you show. Just before we move on to the wonderful Dr. Elaine, can you just mentioned about like how important it is to kind of track and that sort of thing, in case anyone's listening and is thinking, how do I track a period other than looking my knickers? Like, do you recommend just on someone's phone calendar, or like if someone's very new to this, how would you track your period and anything unusual?
Yeah, so day one of your cycle is always the day of your first bleed, and then your cycle ends when the day of your next bleed is. And I think Elaine will correct me if I'm wrong, but so yeah, you can track that in a calendar. You can track that. There's loads of apps out there as well now. But it's just really important. Then the more you get into it, you can Instagram this stuff. You can start tracking everything from your boob size to what your discharge look like. And it tells you all different things. But yeah, the main thing to track is the first day of your period and the last day of your period, and how heavy your flow is normally.
That's like a good starting point to get used to it. And thank you for saying the word discharge, because it's the word I find through my talks and stuff at Eve, that sometimes people bulk at that word more than vagina or period, because it's like, oh my god, we can't talk about the fact that we have like a sticky mess in our knickers. Look, if you've got
if
you've got a vagina and the cervix and all of that stuff, you will have discharge. The whole point of discharge, it looks after your vagina for you. It can, quickly, I mean, don't use any scented products in your vagina. Don't use any washes or anything like that on the vulva. Don't put anything up there that shouldn't be up there, because it will disrupt your vaginal pH, and your discharge can turn unusual because of bacteria and stuff. your vagina is self-cleaning. That's not really got anything to do with what we're talking about today, but I have to say it because when I was younger, would want to like smell really fresh, so use like scented wipes, scented creams and stuff on my vulva. No, like you shouldn't smell like a bed of roses down there. You should smell like a vulva and vagina. It changes throughout your cycle. It'll be thicker, thinner at different points depending on your fertile window. Discharge, if you've got gynae anatomy, you will have discharge. It is the point. It looks after the vagina for you, keeps things nice and slippery. It's a wonderful thing. Please never
of the body. That's what I think. Self-cleaning helps with pregnancy and all manner of things. It's wonderful.
Exactly. Discharge is a gorgeous thing. And we'll talk a bit more about like signs to do with cancers later when discharge changes. But yes, discharge is a great thing. Don't do anything to tamper with it, please. Okay. Terry, I love you, but go on mute now, please. And I'm going to ask Dr. Elaine Hampton, who is a GP and our Leukaemia Care representative, health representative, so she's the pro on the bill. You have unmuted already. Thank you, Elaine. Hello.
Hi.
Is it still light where you are?
It's getting dark.
Where are you?
I'm in North Wales.
Right, I'm in Peckham, represent. It is pitch black outside. I don't see how this is happening here. I'm excited to talk to you about health stuff, but I just need to say I'm very jealous of this home situation you've got going on.
I'm further north than you are, aren't I?
Look, I'm a lover and a vagina person. I'm not a geography. I was about to say geographist. I don't know. So I don't know if that makes any difference, but fine. Good for you, Elaine. Thank you for taking the time to be here. Can you just kind of briefly introduce yourself and what you do and kind of why you're associated with Leukaemia Care and your interest in that?
Yeah, I am a working GP in Bangor in North Wales, but I'm also a Macmillan GP facilitator, and through that I got involved with Leukaemia Care. So they occasionally ask me to come on as a panelist on one of their webinars. So yeah, so I've learned an awful lot more about leukemia than I knew before since doing this work with Leukaemia Care. Perfect,
thank you. So as our resident medic, the first question I want to ask you, because as I said before I spoke to Emma, I knew nothing. What are the most common signs of leukemia? Because I don't have a clue.
Right, okay, so the most common signs of leukemia, basically the most common one is fatigue. You can also get fatigue's usually caused by becoming anemic, basically. You also get shortness of breath, again, often because of the anemia that you get because of the leukemia, because basically with leukemia, your white cells proliferate, which means you get less of the red blood cells, which carry oxygen around, and you get less platelets, which are involved in clotting, hence why you can get problems with bleeding and bruising.
So it's completely different to, for example, a breast cancer and finding a lump in your breast. It's like a whole other different, under the cancer umbrella, but completely different disease.
Yeah, absolutely. It is very different. And it also, because of the way it is, it tends to present with symptoms that what we call vague, as in they are not particularly specific to leukemia. They could be caused by lots of other things. I mean, a breast lump can be caused by other things other than breast cancer, obviously, but breast cancer is quite high up there on the list of possibilities when you're thinking about breast lump. When somebody comes in saying, I'm feeling really tired, there's so many other reasons why they could be feeling very tired other than having a leukemia or another blood cancer, basically.
Of course, yeah. So we got to tired and shortness of breath.
Yeah. So fever and night sweats, because of the problems with the white cells and things, that people often can get infections, so recurrent infections and things can be quite common. And also people get bony and joint pain. That's quite common, again, because basically the leukemia is affecting the bone marrow in the bones, because that's where we make blood cells, basically, is in the bone marrow. And because of the way the bone marrow has been affected, then that causes a lot of pain as well.
Mm-hmm. And is like, so obviously this is a kind of a bleeding event. Can you just talk a little bit about sort of the link with leukemia and heavy or unusual or abnormal, however we want to phrase it, bleeding? Is that kind of one of the more common signs, like the tiredness, or?
Well, I was saying earlier when we met before, as I was going to say, is having been a GP for over 20 years now, I've not ever seen anybody be diagnosed with leukemia having presented with abnormal menstrual bleeding. Having said that, though, I see a lot of women with abnormal menstrual bleeding as well. So although some people aren't presenting, as Terry was saying, and things because of various taboos and worries, and some people just are too afraid that they're going to have to go through an examination and all sorts of stuff. There are still a lot of people presenting with abnormal bleeding. So I mean, when somebody comes in saying they've got having bleeding problems, you know, one of the first things we have to do is check out the language and make sure that my understanding of what they're trying to tell me is what they're trying to tell me. Because some people get found this, as I'm sure Harry has found this in her meetings and things, is people use all sorts of weird and wonderful terminology and can be very, very vague about what they're actually talking about, and so it can take ages to actually understand properly what people are talking about. But there's zillions of reasons why people present with abnormal menstrual bleeding or non-menstrual periods. Often we worry more about bleeding in between periods and after the menopause. So menopause is when you've not had a period for 12 months, so anything after that's abnormal. So I always try and make sure when I'm talking to ladies in the lead up to the menopause and things, that I explain when we would be worried if they suddenly had another bleed, basically, because that's really important. People are aware that we do want them to present then. Mainly because what we need to do is check them out for endometrial cancer. At that point, usually is my first thought, but obviously leukemia can be one of those things that presents at that time too.
So with so I mean, I know about like the gynae sort of typical ages for gynae cancers. With leukemia, is it a kind of, I hate labeling things as a younger person's disease or an older person's disease, but is there, for example, so if someone that was post-menopause came with bleeding after the menopause and came to you, that would be more of a red flag for womb cancer than if a 20-year-old came to you with you know, a heavy bleeding, for example. You'd worry more about womb cancer for the older person that hasn't had a bleed for a while. Is there a sort of age range where for leukemia there's a little bit more of a potential warning sign because it is more common in certain age groups, or is it kind of across the board?
I was going to say is that you do get a lot of leukemias in children. You do get a proportion in children, and then it is actually it is usually in older people. But it's one of these cancers that can occur across the age range as well, basically.
Yeah. And if someone came to you and said, so you described like the different types of abnormal bleeding, which we can talk about a bit later in the gynae section. So for example, bleeding between periods or bleeding after menopause. If someone came to you and said, I've got those things, those types of abnormal bleeding, what would your first thing be to do? Would you kind of check how long they'd had it for, or would you kind of immediately need to examine them or check their family history? Like, what would be your first piece of the puzzle?
Well, as I say, first of all, you actually need to work out what is actually going on. What's actually what was normal and what has changed. Actually, one of the things we're trying to do is work out what's actually changed here. You know, so I was going to say, because some women have always had heavy periods, whereas for a woman who's always had light bleeds to suddenly start having heavy periods is a big change. And I think Terry mentioned this one a few times. People actually knowing. One of the things with cancer is actually knowing what's normal for your body. And so therefore so that you can actually notice when something's actually different. So as I say, periods that have suddenly become a lot heavier. As I say, if they're bleeding in between your periods. But as I say, there's a huge loads of things that I would be thinking, you know, am I thinking, could this lady be pregnant? Could she have an infection? You know, these are things that are really, really, really common to start off with, and things, you know, is it caused by her contraceptive method? Because all the hormonal contraception methods we use can cause all sorts of funny bleeding patterns and what have you as well. So sometimes it's actually quite difficult unpicking exactly what's going on and actually trying to decide, you know, when is this abnormal enough that I need to do something about it? I mean, the thing with bleeding and heavy bleeding is, though, because I'm thinking, because somebody's been bleeding so much, then what I would probably be doing is checking their full blood count to see if they're anemic, mainly because they've been bleeding so much, and that's what I'm thinking of. But then should they have leukemia, then coincidentally, that's what's actually probably going to pick it up and actually make the diagnosis, rather than me thinking, oh, I better do their full blood count because they might have leukemia. I'm thinking I better just check their full blood count in case because they're anemic because they've been bleeding so much. So we're actually looking at it from the opposite way round, in a way, as you would when you was coming from a leukemia point of view.
And kind of we've spoken a bit with Terry about kind of like the importance of being able to like talk about what is the matter, like what your problems are. As the non-patient, you're the other side of the table. How absolutely, because GP appointments, they're not very long, you're so busy, so obviously it's about making the most out of that sort of 10 minutes with you. How important is it as a GP that people, you know, if possible, and they're able to learn like correct terms for their bodies, and like Terry was saying about like tracking changes and things, kind of how important is it and helpful is it to you that they have the correct terms and kind of knowledge about what's changed and where in their body it's changed?
Yeah, I was going to say it does help, especially, I mean, I don't actually mind what terminology people use, but as long as we're quite specific about it, rather than just, because a lot of people can go, oh down there.
Where is that? Yeah.
That could mean all sorts of things. I've had people say, oh, down there, when they've actually had a problem with their belly button, sort of thing. So as I say, it varies so much, but as I say, some preparation for the appointment can be really useful, thinking about what is it that you're worried about, basically, you know, what's changed that's actually prompted you to think, I do need to check this out, basically. And to be honest with this sort of thing, the majority of it, although examination can be important, usually examination is just to make sure you're excluding things. A lot of the time, most of the time when you're making a diagnosis, it's actually talking to the patients and on the history and actually finding out what's actually changed and what's actually happening. So as I say, the preparation to have actually thought about it. I actually think these period tracker apps are actually wonderful, because the amount of women these days who actually, when I say when did your last period start, they actually know when their last period, or say, oh, I'll just check on my phone. At one time a day, people used to look at me completely blankly as though, well, what's that about?
Yeah. So technology is really helping.
Coming in to tell me they're pregnant, and I'm saying, well, when did your last period start? Because that's how we work out how pregnant somebody is. And they look at me and go, oh, well, I'm not sure, it might have been last month or maybe the month before. So
it's like, are you 2 or 3 months pregnant? I don't know. Yeah. So thinking about kind of menstrual bleeding that's different, or vaginal bleeding that's different for what's normal for someone, we don't want to kind of worry people, but what would you kind of say to people who maybe have experienced some changes to their bleeding or have had some unusual bleeding, and kind of, what would you sort of say to them if they're feeling anxious and not sure whether to go to the GP, or are really scared it's something serious and, you know, are getting in a state before their appointment, that sort of thing, kind of the anxieties around it?
I really appreciate why people get anxious, but I often know what I actually say to people, well, come and talk to us. I mean, I can't promise people it's not going to be cancer before they come, or it's not going to be something really serious. But basically, if we check it out and it isn't something serious and it is something we can see easily sorted out, great, they can stop worrying. If it does turn out to be something really serious like a cancer, then the sooner we actually find that out, the sooner that something can be done about it, and the better the outcome is likely to be. So it's always worth getting it checked out. If you're worrying about it, then you need to get it checked out, basically.
That's a gorgeous note to end that section on. Thank you, Elaine. If you are worried, get it checked out. Thank you, Elaine. We'll come back to you because I can imagine that a fair amount of the questions are for our resident medic. I'm getting that kind of vibe. I don't know what's telling me that. So I would now like to ask the lovely Kate Stallard to unmute herself. Kate is our wonderful, do you want to be like a patient perspective or like real life story? I feel like that's the kind of like the Take a Break magazine, isn't it? Kind of like real life story. Kate has leukemia and she's going to talk to us about what happened, aren't you, my darling?
I am, yeah. So I'm Kate. I was diagnosed with acute promyelocytic leukemia in 2016. I'm in remission now after extensive treatment, but yeah, I just wanted to talk to you guys about sort of how I experienced heavy menstrual bleeding in the lead up to diagnosis, and how that affected the actual diagnosis. So I'll sort of start with the fact that acute leukemias are generally quite aggressive and the build-up is generally quite short to diagnosis time. So really,
are there many different types of leukemia? So it's not just, hello, you've got leukemia, it's you've got sort of specific,
That's it. So you've got your chronic leukemias and you've got your acute leukemias, and then within those there's different types as well. So my type of leukemia is called APL, and it's a very rare type of leukemia actually. So on presentation for me in terms of menstrual bleeding, I'd say the week before I was diagnosed, it was my period and it was exceptionally heavy, and I mean exceptionally. It was to the point where I was using sort of super strength tampons and super strength towels together, and within 2 hours I was bleeding through both and then bleeding through clothes as well.
And that is not, we hate the word normal, but that isn't normal.
Yeah, exactly. It's completely abnormal. And you know, I realized that as women you have varying types of periods. Sometimes they can be quite light, some can be heavy, but this was, you know, ridiculous. And so it was one of the symptoms that I had that prompted me to go and seek an appointment with a GP, along with a whole host of other symptoms of leukemia. But for me, it happened quite rapidly. So looking back, I can't sort of remember the period before that being exceptionally heavy. So yes, it was that one really that prompted me to go. Yeah.
So like a big red flag that made you think this one big heavy, so heavy, you must have felt so exhausted and stressed trying to change products every couple of hours. I can't even imagine like exactly. How overwhelming.
Yeah, it was, and it just didn't feel right at all, you know. But on top of that symptom, there was a lot of other symptoms as well that I think Elaine has listed many of them for leukemia. So bruising, lots of bruising, unexplained bruising, a really intense headache, which was not like a normal headache. It was like a pounding, you could hear your heartbeat in your ears, especially if you tried to do any form of exercise or bend down, even just walking, you know, you'd hear it whoosh, whoosh, whoosh. Fatigue, fevers, repeated infections, bone pain. I had a really intense pain in my neck, and difficulty in breathing, sort of a breathlessness feeling.
And was that all quite a while before that big heavy bleed, kind of the pain and headachy and that sort of stuff? Was that for a while before the sort of bleed, the heavy bleeding?
Not too long, to be honest, a couple of weeks, and then obviously period came when it was due to, but yeah, just came exceptionally heavy. And I was still Sorry, go on.
No, I was just going to say, so it wasn't like you ignored signs for months on end?
No, not in my case. It was literally a matter of weeks. It just got extensively worse as the days went on. And at the time, I was sort of exercising. In fact, the week before diagnosis, I ran a 10K, a kind of limped around.
You're one of those, are you? Oh,
well, I wasn't, and I was trying to be one of those.
Don't ever change, Kate. If you're not a natural runner, stop trying, okay? They can stick to their lane and we'll stick to our just like.
Yeah, I was not a natural runner, and the fact that it took me an hour and a half to do a 10k kind of says something. But yes, the fact was I was massively struggling with leukemia at the time, unbeknownst to me. So it was a culmination of all of those symptoms really that kind of led me to think, right, there's maybe something seriously wrong here. So the period on its own, if that had been on its own, yes, I would have been concerned about it, but I probably wouldn't have worried so much. I think I would have definitely gone to the GP to sort of say, whoa, because it didn't seem to want to end either. It was just sort of going on and on and on.
Was it a longer period? You said how heavy it was. Was it a longer period than your normal?
Yeah, a little bit. Like it was, well, normally for me, periods sort of pre-cancer were only heavy for a couple of days, and then it would sort of peter off.
And then we just get stuck with that brown discharge, don't we? Where we're like, oh my God, I finished bleeding. And then you don't wear anything. And then you wear like a fun pair of knickers and then you pull them down and have a wee. And there's just this brown discharge in there, like 2 days later.
Exactly.
It teases us.
It's very satisfying about the day after your period where you can wear underwear without having to wear anything, It's like,
yeah. Underwear and nothing else.
Yeah. So yes, I would say it was heavy for a prolonged period. And then so yes, that led me to going to the GP, and I wasn't actually embarrassed or concerned to speak to my GP about it. I think I've never kind of been prudish about periods or talking about it. So for me, that wasn't a concern. I understand for some people that might be, but I think if anyone's sort of thinking, with leukemia and having a heavy period as a symptom, if it's, would you know, how would you know? Well, for me, it was, you couldn't deny it. You couldn't ignore this period. It was just ridiculous. And I know a few of my friends who have also had leukemia have said the same thing. It was just like whoosh, No, I didn't feel at all ashamed or fearful to go and speak to the GP. Unfortunately for me, my experience during that appointment was pretty awful.
I'm sorry to hear.
And I know this isn't the case, and I'm not GP bashing at all, because as Elaine said, it's blooming hard to try and actually ascertain that somebody might have leukemia from one appointment, and also with a sort of vague set of symptoms. But I think with working with Leukemia Care over the past few years, there's a recurring trend that it's the sort of the fact that people are coming with a set of symptoms, and that should set red flags off, and hopefully it does. And as Elaine said, even just a simple blood test can then sort of set the trail off in the way of leukemia. That's all it takes. For me, my symptoms in that first appointment were just dismissed completely, all of them, and nothing was checked at all. And I had to really fight to ask for a blood test, and was then told it wouldn't be an emergency, so I'd have to wait a week at least to have the blood test.
Did you ask for that blood test during your initial first GP appointment? Yeah, fine. And did they, because one of the things you mentioned was this really heavy bleed, did they want to, if I'm okay to ask, and you can say if not, did they want to give you like a vaginal examination in that appointment because you'd mentioned a vaginal bleed? Or
no, nothing. There was no examination done at all. It was just dismissed completely. So the main sort of red flag for me, and the fact that I pushed for a blood test, was that my sister had actually had aplastic anemia a few years prior, which is a really serious sort of blood disorder. It's not a leukemia, but it is a blood disorder. And I was worried that, potentially this was happening to me or something similar. And I did voice that, but again, it was dismissed. So I think what the point I'm trying to get across here is really push. If you're feeling or, experiencing these symptoms, even if it's only a couple of these symptoms and you're worried, push for a blood test, and please do say to your GP, this is really troubling me. I do have these symptoms, and I appreciate that, you know, they may be nothing, but I would like to have a blood test. If I hadn't have been diagnosed 2 days later from that appointment, chances are I wouldn't have made it to that blood test a week later, you know. So it's really vital, I think, that not only that we educate ourselves as to the symptoms and signs of leukemia, but also that medical professionals do as well, you know, or at least have it in the back of their minds that, okay, potentially this could be a blood disorder of some sort, especially a leukemia, if people are presenting with certain symptoms. And if it is just a matter of a blood test, then why not do it, you know, just to check. I have to say that 2 days later I ended up in A&E, and with an out of hours GP who was just absolutely fantastic. Just took one look at me and thought, right, you know, something's seriously wrong here.
Something's not right here. Yeah.
And immediately did, well, a urine test that was just pure blood, basically.
Wow.
Because of the heavy menstrual bleeding, and examined me from head to toe, did a emergency blood test, and then from that night onwards I was in hospital for weeks and weeks. So, and I also at that point had sepsis, so that had gone misdiagnosed as well. So there's a lot of things that.
But you had everything going on, Kate.
Yeah, and a lot of acute leukemia patients who are diagnosed are very much similar to me in that they're diagnosed in an emergency situation. And so by that point, they generally do have, you know, quite a few other things going on, lots of infections or sepsis, you know, there's other things going on.
Of course.
Yeah, but I think for women, and especially for me and the friends that I know who've been diagnosed at a similar age, so I was 30 when I was diagnosed, have all experienced sort of heavy menstrual bleeding as part of the lead up to diagnosis. And it was so heavy that I ended up having to have a lot of medication and drugs whilst in hospital to actually stem the bleeding. You know, it was that bad. So yeah, I think it's a really important symptom, I think, to be aware of. Yeah.
So yeah, you really are advocating for, if someone is worried about an abnormal period or bleed, to kind of, it's so important to talk about the link between that and potential cancer, because you're an example of this, aren't you? That, you know, that 2 days later hospital trip, it was life-saving.
Completely, absolutely.
Yeah.
You know, I'll be forever grateful, not only to that out of hours GP, but to the man I spoke to on 111 when I was, you know, feeling like that was it, I was going to drop off my perch. He was just fantastic, and you know, they couldn't have done anything better. So I think if you're concerned about something, especially if you do have other symptoms as well that you're sort of worried about or troubling you, you know, just go and see somebody, go and see the GP. Yeah.
And would you, in kind of like sort of terms of tips going to a GP, would you sort of echo what Terry said in terms of keeping a diary in whatever form, and like Elaine was saying, just have notes of, you know, I'm Kate and I got that headache on that day and that bleed was much heavier, and just kind of, if you start to feel things are going a bit weird for you, start writing it down, diarising it. Yeah,
totally. Yeah. And, you know, yes, one of the symptoms of leukemia is fatigue. And so you can be feeling like, I haven't even got the energy to book an appointment, let alone go to it. But I would strongly say, yes, go, bring as much information as you can. And if you're unhappy with the kind of response that you get, then say you want to book in with another GP, or say you want to see somebody else. You know, there's ways that you can get seen, basically. But yeah, go in with information. As Elaine said, be specific. It helps the GP then to actually help you. You know, exactly. Be as specific as you can. In my case, that didn't help, but you know, thankfully it did 2 days later. So yeah, I think it is just a case of, you know, arming yourself with as much information as you can, because again, you go and see a GP and the sessions are so short, aren't they? You've really got to sort of be specific and boom, this is what I'm feeling, this is abnormal because I normally don't have this, or whatever you can to help, really. Yeah.
You're one of those, and I'm allowed to say it because I've also had cancer, so I can say it to Kate, you're one of those people that has, I bet you've had this said to you loads of times, turned a cancer diagnosis into something, because you're now advocating on the board for Leukemia Care? Was it really, and I bet people called you inspiring as well, I bet that's been thrown at you. Have you kind of, what made you want to, once you had cancer and kind of went through treatment, etc., what made you kind of want to take the step from patient or ex-patient to kind of advocate and voice for what you'd been through?
Yeah, I think for me, it was going into a cancer diagnosis at 30 was utterly terrifying, and it was a horrible sort of journey. I hate that word, but journey, for want of a better word.
You can say it because you've had cancer. We can all say the words brave, inspiring, journey, but only if you've had cancer. If you're listening and haven't had it, you can't say any of those words to us. We can say it to each other.
Yes, true.
Yeah.
So yeah, going through that and having all of the extensive treatment, it just made me realise the sort of lack of support and information perhaps that was available, and especially prior to diagnosis. You know, the fact was that I was telling my friends that I had leukemia, but they were all sort of saying, what is it? You know, it's kind of one of those diseases or illnesses that you think of, perhaps you think that maybe it's just young children who, you know, you hear a lot about childhood leukemia, but leukemia can affect anyone at any age. And I think I just wanted to be involved with raising awareness around it, but I also wanted to get involved just to help patients, you know, to give them the strength and the information to kind of fight for themselves, because I feel that sometimes that's lacking. And I also wanted to sort of get involved with the mental health side of things. You know, I think as a patient, it is mentally one of the toughest things you'll ever have to go through is a cancer diagnosis and treatment and everything else that involves. Myself, I actually relapsed, and so ended up having to have further treatment, and it went down routes that, you know, were just pretty horrific. And I think I just wanted to get involved with a charity like Leukaemia Care, who are fantastic, spread the word about the support that's out there and sort of inform not only patients but people in the medical profession. You know, I've done talks for the Royal College of GPs and things like that, and it's just the feedback you get is fantastic. It's that raising awareness of, let's just try and get this little earworm in, that these symptoms, ping ping ping, you know, let's
get that cog turning, like, let's rule out leukemia, let's think about it and rule it out. Yeah,
exactly. And I just think, I know I've said it a million times tonight already, but a simple blood test can actually help in the diagnosis to leukemia massively, and it's such a relatively cheap, you know, diagnosis tool. I don't know why it's so hard sometimes to just get a blood test. So yeah, I think that is why I wanted to get involved, basically, to give more oomph to the leukemia kind of awareness, really.
Thank you, Kate. You are now I'm going to talk about myself, because it's my turn in the schedule, not because I don't like Kate. But you are brave, inspiring, and thank you for sharing your journey. I've said that to annoy you now. But thank you. So it was so interesting to, I couldn't have even imagined a fraction of what you'd said. It wouldn't have even occurred to me, and I'm sure if people are listening and don't have a connection already with leukemia, that information is hard to hear when it's someone's personal experience. Of course it is, but the way you kind of shared, like, so openly and articulated everything so clearly, from what happened to you to what you want to happen to future patients, because there will be, because we don't have a cure. It was just brilliant. So thank you so much. And just hang around, because I'm going to talk a bit about myself, and then we'll go to questions with everybody off of mute. So thank you, my darling. Thank you, Kate. Hello to everybody that's still here. Yes, Bake Off starts in 2 minutes, so hopefully I can guilt trip you into staying. So I'm just going to spend a few minutes talking about myself. So I started working at Eve Appeal about 5 years ago, and I came to work through the Eve Appeal because I had cervical cancer when I was 24. Now, when I say, sometimes I don't say the age that I was diagnosed, I just say a few years ago. because one of the first things that people will say to me is like, oh my God, that's under the smear test age. So the age for screening is 25, and I get a lot of questions asking, you know, don't you wish the screening age was younger? So straight away I'll be upfront in how old I was, and do I think the age should be lowered? I'm not sure. If I'd had a screening test a bit earlier, then you know, maybe abnormal cells would have been picked up rather than a cancer. But you know, it's 25 because it's not shown to be effective in saving lives, and it's very rare to have a diagnosis under 25. We do hear about it, but through, you know, various research programs, etc., it's not been shown to be overall beneficial in having the age of 25. And for example, Scotland, not that long ago, maybe I think even a couple of years ago, I'm not sure, but recently changed the age from 20 back up to 25. I know that is just my opinion. That's not kind of not Eve's opinion, although they often correlate. It's a very sensitive subject for lots of people, which I completely understand. And yeah, so I was 24 and I'm not angry or bitter about the screening age. So what happened in terms of bleeding? So the reason I'm talking about my experience, as well as kind of just hosting an EV stuff, is that abnormal bleeding was my sign, my only sign. So Kate was mentioning how she had the unusual bleeding, which for her was very, very, very heavy, and had other symptoms such as, you know, the pain, etc. I only had bleeding between periods. So, and I mentioned that's kind of a type of abnormal bleeding. I didn't normally bleed between periods, so for some people it's normal to get a little bit of bleeding in the middle of their cycle around ovulation time. You know, a percentage of people have that, and that's normal for them. It wasn't for me. I was on the combined contraceptive pill at the time, and I'd back-to-back packets, so I didn't have a break, I didn't have a bleed, which is safe to do if you have about 3 packets in a row. It's called tricycling, and that's fine. It's safe for your body to do so. But because I was had packets back to back, I was going on holiday and I didn't want to bleed when I was on holiday. And I noticed in the middle of kind of having all the packets back to back, I had a bit of bloody discharge, which was very unusual for me, never had it before. So I thought, oh, okay. And then I had sex with my then boyfriend. He has a penis and I have a vagina, so it was vaginal penetration. And we're not together anymore, but that's like, you know, if we all end up meeting up and going to the pub, everyone that's joined the session, that's when I'll tell you what actually happened. But we had sex, and then afterwards, on my genitals, on his penis, on the bed, everywhere, it was bright red blood. And it was so unusual. I've never had anything like that happen before. I initially thought either he had cut himself or I cut myself or something. Went to the toilet and it was still there. And he was like, oh, is it because I'm too big for you? So I went on to Google, and I, now working at Eve and running the Ask Eve service, I sometimes tell people if they come to me and are overly anxious to stay off of Google, because you have to remember, like, if I have a great restaurant meal, I'm much more likely to not write a review than if I had a terrible experience. I think we have to remember, like, in forums and things which are really helpful, for example, and kind of Q&A pages and various websites, they are really helpful because they can give information, but they can often be scary because the worst case scenarios, the horror stories, are on there, which is understandable, kind of like with the restaurant analogy. But Google saved my life in this case, because the top results when I put in bleeding between periods and after sex were like an STI. So if chlamydia isn't treated, for example, it can kind of go up into the gynae tract and turn into pelvic inflammatory disease and cause unusual bleeding. So the top results were like either an STI or cervical cancer. And yes, I do stand-up comedy when I'm not at Eve, so if I make the odd joke, deal with it. But I booked a doctor's appointment and genuinely, joking aside, kept my fingers crossed for chlamydia. I hoped I had an STI that had gone untreated somehow. So I went to the GP, I had an examination. So when you have a vaginal examination, she's got props, you will have a speculum, inserted into the vagina, because I didn't know this before I had a problem with my gynae anatomy, but you see on diagrams, don't you, kind of the womb, the cervix, and then the vagina, and I just thought the vagina was kind of open all hours, like it was just open the whole time, but actually it's closed and opens upon something going inside. Like it will open up a bit to let a tampon in, a penis in, a speculum in, a toy in, a finger in. So the speculum will go in like that and hold the vagina open, and then they'll either look, or if a little brush, which I haven't got, will go through, and the cervix, which you can see at the end of the vagina. So the cervix is at the top of the vagina, between the womb and the vagina. It's like the neck of the womb. Looks, this isn't to scale, but it looks, when faced head on, like a little donut. And so it'll be like that if you're standing up, or like that if you're lying down. Not to scale, not overly accurate, but a good prompt. So yeah, I had an examination, and she could straight away see that my cervix looked quite red and angry because of the bleeding. So I was referred for a colposcopy, which is a closer examination of the cervix, basically using an instrument called a colposcope. And if anyone has an abnormal cervical screening result, you will go for a colposcopy. It's a common gynae referral appointment. It does not mean you have cancer, it just means more investigation is needed. So if anyone's listening and thinks, oh, my friend just got told she has to go for a colposcopy, it obviously can sometimes mean bad news and that something serious is going on, but doesn't automatically. But I went for the colposcopy, and the lovely doctor had a look at me, took a biopsy, which is a small sample. It's not related to cervix, it's related to the whole body. So biopsy means kind of tissue sample. And I was panicking, and was really upset and worried. And I sat down, and I just, when I got dressed, and I said, is it cancer? Because I'd seen the words on the internet, and it was all feeling a bit more serious now that the doctor had taken a biopsy. And he said, I've been doing this for 30 years. We need to wait for the results of the biopsy, but I would be surprised if it wasn't cancer. So for me at that point, that was when I started to think, okay, it's likely it's going to be kind of bad news when the results come back in a couple of weeks. And that's when I started to prepare myself, rather than kind of staying hopeful and perhaps in denial until the biopsy results. So for me, I kind of had more of a gradual transition than a kind of hospital test, you have cancer. I sort of tried to ease myself into it, because I found it very, very difficult to cope with, like Kate was mentioning, the mental health side of things. And yeah, so I sort of prepared myself, and it was cancer. And it feels very odd to say lucky when you talk about cancer diagnosis. Like, I was 24 and had cancer, that's crap. But it was a late stage 1, so it was contained to the cervix. So I had an operation called a radical trachelectomy, which took out my cervix and like the top third of the vagina, and the lymph nodes, which are kind of like little sort of things that connect your whole lymphatic system. If they were positive, then I'd have had to have chemo and further treatment. They were negative, and I've never been so pleased to hear the word negative in my whole entire life. Although I panicked initially, and when he said the results are negative, I was like, do you mean negative in feeling that it's bad news? And then I kind of got my head straight. So because I reported the abnormal bleeding, I was diagnosed at an early stage, and I'm completely aware, kind of, Terry was talking like so wonderfully earlier about the different barriers that everyone faces, particularly the groups of people that she works with, but also with every culture, every community, every background will have different needs or reasons why they might find these types of appointments, vaginal examinations, etc., difficult. I'm very, very aware when I tell my story of an early diagnosis, even though it was at a young age, it is lucky in the grand scheme of, people have been so much more poorly than I could ever imagine being. I'm very aware of my privilege when I talk about it, so I don't want to kind of not acknowledge that, I'm a cis, straight, white woman that had an education and grew up in a family that talked about periods openly, used to borrow my mum's pads and stuff like that. I don't have a physical or learning disability, so I was kind of able to physically, because lots of places don't have equipment for people that are wheelchair users, I was able to, you know, say what was wrong, get myself to the appointment, didn't feel uncomfortable or withhold going, or, you know, I didn't feel embarrassed about the examinations. I kind of, it was quite a quick diagnostic process, and I'm aware that's because I was lucky to be in a position for it to be quick, if that makes sense. So I want to say why. So I've got my little prompts here. I felt, yeah, I definitely felt very confident talking to a healthcare professional, but I think, as we've heard tonight, it's not always smooth sailing when trying to communicate with your doctor. So I completely appreciate that can be difficult for some people. The really important thing in terms of gynae cancers is, so I've kind of told my personal story, but the reason kind of Eve harps on about on our social media and our website and all of our channels so often about abnormal vaginal bleeding, i.e. bleeding between periods, after menopause, after sex, bleeding that's much heavier or longer than is normal for you. Like, you know, Kate said earlier, people have heavy periods, but you're and that's so true, that you shouldn't be kind of like in such excruciating pain. It shouldn't be floodgate central all the time. It doesn't mean it's a gynae cancer, but it means it's something that needs looking into. Just because something isn't as serious as cancer, it doesn't mean that you should have to put up with it. And abnormal bleeding, kind of the umbrella term and all the various things it can mean, are a key sign of 3 of the 5 gynae cancers. So the 5 gynae cancers, in order of prevalence, how common they are in the UK, are womb, ovarian, cervical, vulval and vaginal. And abnormal vaginal bleeding, i.e. bleeding from your vagina when you as an individual are not expecting to, are key signs of womb, cervical and vaginal. Womb cancer affects over 9,000 people every year in the UK, cervical about 3.5, vaginal a few hundred. So it's not nothing. They're not as common as you know, the big 4 cancers, for example, but it's absolutely a key sign for thousands and thousands of people, women and people with gynae anatomy every year. So yeah, that's why kind of we're super passionate. I was so excited to come and do this event, because it is quite literally a red flag for over half of the gynecological cancers. And yeah, Ask Eve, I'll just say quickly about that and we'll go to questions. That I love my job. It's a privilege to be able to do, but it does break my heart when I hear from people that you know, that don't feel they can go, or they feel like they're being, the biggest thing I hear, I guess kind of going back to the kind of gender gap that Terry mentioned at the beginning, is that people that have kind of abnormal bleeding don't feel that they kind of can justify going to the doctors. It will be like, oh, I'm really busy, I you know, is it worth it because I haven't got that much time, or I don't want to bother my GP. And you know, we've heard from Elaine, if you have a concern, seek help from your GP. It is so important to do that. But I think often I'm just name dropping everybody at this point, but like Kate was saying about how important it is to kind of advocate for yourself and speak up, and I would completely echo that, because if you, kind of to sum up before we go to questions, if you think something is wrong, the chances are statistically it's not going to be something as serious as cancer, but it's our job as people that work with these charities, these people that have had cancer ourselves, it's our job to tell you to advocate for yourself and to go to your doctor, because in some cases it will be cancer, most cases it won't be, but please get checked out just in case. So fine, mic drop. So now Emma, I'm going to go to the questions. Shout if that's not what you want me to do, but if not, I'm just going to go for it. So excuse me while I just look at these other documents. Why don't my lovely panelists come off mute? Because we might want to, even if I direct it at one person a question, someone else might want to say something. So this is kind of the woo bit. We'll just have a party. So okay, what shall we ask first? Okay. Okay, so Elaine, somebody has said, I have really painful periods which sometimes make me pass out. I think I know what your answer will be, but should I see a doctor and what could it be?
I'd say yes, they should. And I say, I think if it's that painful, it certainly needs checking out and such. even if it's something you've had all since you started having periods. I mean, it might simply be what we call primary dysmenorrhea, which means you've always had painful periods. It's just making sure that you're getting adequate pain relief and actually discussing ways of actually controlling it and things. If it's been a change, yes, it needs checking out to see if there's an underlying cause.
And okay, so we've spoken a lot about the different kind of types of abnormal bleeding, and you mentioned that you know, contraceptive devices and different types of contraception can cause different types of bleeding. So someone's asking, what's the difference between implantation spotting? So that means basically you're pregnant, doesn't it? Early stages. So what's the difference between implantation spotting, spotting due to hormonal changes, stress, contraceptives, or bleeding caused by cancers? So how does someone know if it's the pill or the cancer, or am I pregnant, or is it leukemia? Like, where?
I was going to say, again, it's sort of, is this normal for you? So, I mean, you've always had a little bit of bleeding sort of a couple of weeks before your period, yeah, then that probably is normal for you, and can be when some people get that when they ovulate, and things. But, and it also, you know, as I say, otherwise it's not, if it's not normal for you, it needs checking out, basically. So as I say, so if you're starting to get spotting mid-cycle and you've never had it before, then we need to think about what the cause of it is. And as I say, it might simply be hormonal changes and things. You know, sometimes some of the contraceptive methods actually cause irregular bleeding. I mean, the progesterone only methods, especially when people first start on them, often cause quite irregular bleeding, but hopefully you should have been warned about that before it started. That's why we like to review people when they've been, say, 3 months after they've started a new hormonal method, just to see how are things and is there anything abnormal going on, or is there a problem at all, and what have you. So yeah, so I was going to say is, if it's not normal for you, yeah, get it checked out and ask the question, should this be happening, or is it abnormal?
We've had a couple of questions about blood clots, so I'll kind of combine them. Basically, what do blood clots mean, and are they normal during your period? How would you define a blood clot? If anyone's had a blood clot, feel free to describe it. But how would you describe a blood clot, and is it normal, and what does it mean?
I suppose most people describe a blood clot as actually just a piece of blood, basically, that's actually, they say, and some people, especially if they're tending to have heavy bleeds, it can be normal for them. A lot of women do get some blood clots, but again, it's the sort of, if it's unusual for you, then and it's a change, then it needs checking out, you know, because if some women have never had blood clots before and what have you, and all of a sudden it starts happening because they're bleeding a lot more heavily than they were before, again, it needs checking out. It's a sort of like, well, usually I get 1 or 2, but then this time it's been horrendous and it's also gone on for weeks, and normally it doesn't, and things. As I say, it's that sort of like the comparison to what's normal for yourself.
And so I guess maybe Kate slash Karen slash me, someone kind of in terms of advocating for it is asking, how do we convince, maybe, and Elaine can help with this as well, but how do we convince a GP that we've spotted something different that needs investigating without feeling like we're kind of being not listened to or fobbed off, is the phrase that's been used?
I think from my point of view, I would just say, if you feel that strongly that it is, you know, different, and you feel like it's a concern for you, just be really vocal and say that, you know, say I'm really struggling with this, like I feel it's not normal and I'm super worried, so please can you sort of take it seriously and help me find out what it is. Just advocate for yourself and be completely honest. I know it feels vulnerable to do that sometimes, especially with, you know, potentially a GP that you've never seen before. So yeah, I would just say, just try and push as much as you can, really, if you feel that strongly about it, and just be as honest as you can.
And that kind of ties into another question with how kind of maybe between like Kate and Elaine, how would you approach a doctor with kind of queries like this or knowledge like this that we've been discussing without sounding like a hypochondriac. So I think, Kate, like you were saying, sometimes it feels very scary and vulnerable, and you're worried that you'll come across as reading too much into something, or oh, you just read that on the internet, and you know, assuming the worst.
Yeah, I think actually in all of the sort of webinar things I've done with Leukemia Care, you know, you always get that question, how am I going to talk to my GP about a concern without them thinking I'm a hypochondriac? And I think maybe just go in and say that, you know, say to your GP, you may think I'm a hypochondriac, but I don't think I am. I think this is something that's really worrying me. You know, and just say it like that if that's how you really feel about it. I think it can be worrying though, and to think that they're just going to dismiss you, and sometimes they do. But I think if you go in armed with the kind of, you know, say honesty and say to them, you know, you may think this, but I don't think I am being a hypochondriac here. And don't be ashamed to say, I've Googled it. You know, I know everyone goes, oh, Dr. Google, but we all naturally do that. And in before Google times, people would read medical books, you know, the A to Z of medical problems, and go in armed with that kind of information. So I think don't be ashamed to say that, you know, and your GP will help you with your issue if you feel that sort of strongly about it. I think there aren't many GPs that would sort of laugh you out of the room without even sort of listening to what you've got to say. So yeah.
Would you sort of echo that, Elaine?
Yeah, I agree completely, because one of the things I feel is my job as a GP very often is, if there isn't anything to be worried about, to be able to reassure somebody so they can stop worrying. But if I actually don't know what it is they're worrying about, and it might be something that might never have occurred to me that they might have, because some things are obvious. You know, a lot of people coming in with headaches think they might have a brain tumor and things, but as I say, some connections can be a bit more obscure. So if I don't know somebody's worrying about it, it can be really, really difficult to be able to address their concerns and things. I mean, and I say to people, you know, is there some, you know, because sometimes you can tell somebody's not really very happy and things, and even when I sometimes say to somebody, so what is it that you think it might be and that you're worried about? Some people can be really reluctant to actually tell you, but it's so important, because as I say, it's really difficult to know how to actually deal with their worry unless you know what the worry is in the first place.
Thank you both. Terry, did you have your hand up?
Yeah, I just wanted to say like 3 points that we always say to the people that we work with is that, like, you can ask for another doctor. So if you don't feel like that doctor has listened to you, ask for a different one. You're well within your rights. Secondly, you can ask for a longer appointment. So if you feel like it might take you a longer time to explain your symptoms, maybe English isn't your first language and you find it difficult, you can ask for a double appointment. And you can also always ask for an interpreter as well. My mum's lived in the UK for 35 years, but she still prefers to speak in her first language to describe her symptoms, because she finds it difficult to communicate those in English. So you're well within your rights for all of those things, and that should help you advocate better.
Thank you, Terry. Well, Terry, stay there, because a couple of questions have come through for you specifically, so you must have made a good impression on our audience. Does Terry know a website collecting information about the vaccine's impact on periods and the menstrual cycle?
So I know that Clue, the period tracking app, is using some of its data, and I think they recently published a blog. So if you go on their website, Hello Clue, there'll be stuff there. And I think there's been a publication recently, I'm pretty sure I saw it on BBC News, that the World Health Organization has said that it's nothing to worry about. But it'd still be cool to know why, right? Like, it's great, it's nothing to worry about, but why?
Just because something isn't something that's going to kill us, it doesn't mean we don't deserve to learn about it.
Exactly, yeah.
Yeah. Thank you. And the next question for you, Terry, if we can keep you there for a sec, is, at your educational talks, do you talk about the contraceptive pills in regards to your periods? And if so, what do you discuss?
Yeah, so we have a whole session on contraception, which is really cool. So we don't just talk about the contraceptive pill, but we talk about all the different types, because we think it's really important that people have all of the knowledge so that they can make a personal choice about what they want. But we talk about the benefits of each contraception, we talk about the possible side effects, we talk about the impact that it can have on your periods as well, and then we talk about how to access those different contraceptive methods and the fact that you can get them for free. Yeah, I hope that answered the question.
Thank you. Kate, maybe this is one for you slash Elaine. I bled for 4 months straight before being diagnosed with acute, is it myeloid? Am I saying that right? Myeloid leukemia 3 years ago. I love that Emma's bobbing along as well. She's silent, but I can still see her head being like, yes, yes. Yeah, so I bled for 4 months straight before being diagnosed with acute myeloid leukemia 3 years ago. All throughout my treatment, I was told they probably weren't connected. Do you know if this understanding has changed, or were they just not informed then of the symptom and connection?
I think it's very odd that anyone would say they're not connected, because a blood cancer, you know, obviously it's going to affect how you bleed in various ways, mainly due to platelets, like Elaine was saying earlier. You're clotting, you know, blood cells, and with the acute leukemia, especially acute myeloid leukemia, your platelets generally are extremely low, and so you bleed in various ways. You know, you bleed very easily, so it's not only sort of heavy menstrual bleeding, it's things like bleeding gums, nosebleeds, all sorts of well, the bruising is bleeding as well, petechiae, which is like the little sort of pink spots that you sometimes get around on your skin around bruising, or just in general, and that can be another symptom of leukemia due to platelets. So I find that really unusual that person was told that. You know, that seems odd to me. I don't think it's anything new, that it, you know, any new understanding of leukemia that would be linked in some way. I'm pretty sure it's always been known. So yeah, that's slightly odd, and perhaps a lack of or breakdown in communication there.
Thank you, Kate. How would I get I'll take this one. How would I get a test for cervical cancer? So the cervical screening program is not a test for cervical cancer, it's a test for high-risk HPV, the human papillomavirus, and if high-risk HPV is found in the sample, so it's no different for you as the patient. You have the speculum and the sample taken. The sample is first of all tested for HPV, human papillomavirus. It's a massive family of viruses. There are about 13 high-risk strands that can cause certain cancers, cervical being the one that we talk the most about, but also can cause 60% of vaginal, 40% of vulval, some penile, anal, head and neck cancers. But cervical is the one that there's a screening program for, and it's the one that's most affected by HPV. So the sample is tested for HPV first, and if HPV is found, then it's checked for abnormal cells, because HPV is the thing that turns cells on the cervix abnormal. So a cervical screening program starts at 25, you have it every 3 years until you're 49, then every 5 years from 50 to 64. Unless you've had a previously abnormal result, then you do carry on past 64. If you find you have HPV, you have a more regular checkup at a 12-monthly interval. If you find you have abnormal cells but they're low grade, they're monitored at a 6-month interval, because they're likely, if they're just started to turn a bit abnormal, they're likely to return back to normal. If the cells are kind of a moderate or severe grade of abnormality, then they will be removed, because they have a high risk of being eventually developing into cervical cancer. So it's not a test for cervical cancer, it's a cervical screening program that helps prevent cervical cancer. But if you have symptoms of cervical cancer like I had, then you would need to go to a GP, get a referral to the gynae department, and have further investigation, biopsy, etc. there. But cervical screening program, if you have a cervix, you'll be invited when you turn around 25 or a few months before. if you're registered with your GP, so they invite you via that kind of computer system method. If you were born female but are a trans man, and I apologise if I ever get any of the wording wrong in this kind of topic. You know, I'm learning and trying to do better, so if I make a mistake, I do apologise and please correct me. But if you are a trans man, non-binary, but basically born with the cervix and haven't had surgery to remove the cervix but are not registered as female with your GP, then you will not get invited for cervical screening because of the M for male on the record. So if you are registered as male but have a cervix still, then you will need to proactively go to your GP and book yourself in for screening rather than waiting for the invite letters. So yeah, it's not a test for cervical cancer, it's a screening program to prevent cervical cancer. Okay, and I think we'll have like one last question, and then I'll just ask for like one final thing for everyone to say that's really powerful and amazing. So a couple about menopause have come in. So I guess we'll go with this one, because when menopausal status is unclear, how do you get taken seriously?
I was going to say it's a difficult one, isn't it? Because I mean, when you say it's unclear, I suppose that does that mean somebody's actually taking hormones that might mean we don't know whether or not they've gone through the menopause or not, and to get taken seriously. But basically, if you've not been having bleeding for a while, maybe because of your method of contraception and things, and you suddenly start having bleeding, that is something to go and say, I've suddenly started having bleeding, so it needs checking out, basically, really. So I was going to say it's not something that I would, you know, say it's again, it's the change, isn't it, basically.
The change. Thank you, Elaine. Okay, so we are bang on 8:30, which is the cut-off point, no matter how much fun we're having. Starting with, so we'll go Terry, Elaine, Kate, can you just say like one sort of takeaway like thing? Whatever you want. I just want everyone to go pow, pow, pow.
No pressure. I guess what I want to say is that like taboo and stigma, it isn't a joke, and it can like lead to people having a lack of knowledge, a lack of awareness, and like we've spoken about today, people not going to a doctor. So it's really important that we destigmatize periods and that we share and empower more people to know what's normal for them. So if you believe in that too, follow us, Bloody Good Period. We're destigmatizing periods for all. And yeah, that's me.
Thank you, darling. Elaine, final takeaway.
Yeah, I would definitely say if you notice a change with your body, whatever it is, then get in touch with your GP.
Thank you. Kate?
I would sort of echo both Terry and Elaine there and just say, you know your own body, you're the expert of your own body. If you feel that something isn't right or you're concerned about something, go to your GP and just be really brave, honest. And I know it might make you feel very vulnerable and exposed, but just advocate for yourself, be brave, and be really honest with your GP.
I would echo what everyone has just said, and add that there is a lot of kind of shame in society around having something go wrong with your gynae health and gynae anatomy. You've not been a bad woman, you've not been dirty, you've not done anything wrong. If you have gynae health issues, whether that's cancer or something less serious like genital warts, all you can do is try your best to look after your health and notice when something changes. But if something does go wrong health-wise, you're not to blame and you haven't done anything wrong, because dealing with a cancer diagnosis as well as judgment around what type of cancer you have is the most ridiculous, unfair thing I've ever experienced. So yes, don't ever be ashamed and speak up if you feel something has changed. Emma, come back, because I feel like you're going to be the one to say bye to us.
I am. I just want to say thank you guys so much, both the panelists and people who asked the questions and stayed with us. We only had a few people drop off at 8, so that's a success.
Hopefully we guilted them into it.
Yeah, hopefully. But yeah, thank you guys so much. It was so informative and helpful, and I think that the way that you guys talk so openly, it's really made a lot of people feel comfortable, including myself, and I learned a lot, especially with Karen's little tools that she brought out. So thank you guys so much. I'm going to share a slide. Yeah, after Karen's done her donut.
Hello.
I'm going to share a slide that's going to have all of our social media apps on. So if you want to find out more about each organisation, you can either visit our website or go on to our Twitter and Instagram handles and find out a little bit more there. But I just want to say thank you guys so much. And yeah, I hope you have a lovely evening and maybe catch the rest of Bake Off if you really want to.
Stop mentioning Bake Off.
I know,
It's just
I know.
they can watch it on catch up. I don't care.
True. Oh, that's a good point. If anyone came in late or they want to share this with a friend, this has been recorded and it will be uploaded later this week. I'm going to send it around to all the organisations so that we can all upload it on our social media. So whichever of us you decide to visit, it will be on there soon.
Thank you, Emma. Okay, I'm going to press leave now. I'm going to say thanks so much, everybody. It was lovely to have you all, lovely to talk to all of the lovely panelists. I'm sure we'll have some sort of email chain where we all blow smoke up each other's bums. But yeah, thank you. Yeah, I'm going to press leave. Have a good night, everybody. Thank you so much for watching.
Bye, everyone.
Bye.
Bye.